And I believe Paul is going to lead our welcome today. So, Paul, if you would like to go ahead and do that for us.
Sure. So I'm Paul Hanneberger, and my pronouns are he and him, his. If you could put in the chat your name, pronouns, and where you're from, that would be a good way to get started. And I'm from Morgantown, and I'm a retired uh, epidemiologist. I worked at NIOSH for over 30 years. Anyway, uh, Mindy asked me to come up with an icebreaker question, and so the one I came up with that I found is, what's the most unusual thing you have ever collected? And I'll get started by, when I was a kid, I collected matchbooks. My grandparents got me going on that, I think, because it was a very inexpensive uh, hobby, and also so I'd take them apart, and I had a special album to save them in. So, Mindy, do you want to go next?
I do. My name is Mindy Holcomb. I am the healthcare organizer for West Virginia Citizen Action Group, and I live in Morgantown, West Virginia. And strangest thing I've thought about this all day, Paul. I'm trying to think of. I mean, I was an avid reader, so and my daughter is the same way. I've always tried to get her to use the library, but she likes to have the books in her hand and she likes to own them. So, I mean, we like to collect books. Right now, I'm collecting yarn because I've taught myself to crochet and I'm obsessed with the feel and texture of yarn. So yeah. Um, let's see. Rob Freelander, would you like to go next? Rob put in the chat that he is in Morgantown and he's a healthcare and human services
I
for a
didn't
long
figure
time.
out how to unmute,
Oh, that's okay. No time. No
but I haven't
problem.
thought of it. But I haven't thought of an answer to that question yet either.
That's all right. And Olivia doesn't have a mic, but collects snail shells when she finds them. Oh, that's interesting.
Hmm.
Awesome. Cynthia, would you like to go next?
I don't know that I've collected anything really weird. I sort of collect quilts, but they're the ones I make. But
Oh, that's
the
amazing.
ones that I don't give away, at least. And I guess if I've collected anything, well, of course, fabric because I do quilts. But I guess I never thought of it that way. But I seem to have accumulated a large number of coffee and teapots.
Oh, neat. I love them. They're cute. I love fat teapots. They're cute. I'm just kind of going across my screen here. Uh, Peter Anderson, would you like to introduce yourself?
Yes, hi. I'm Peter Anderson. As I put on my pronouns are him, he, him, and his. I live in Charleston. I'm a disabled person, and I do advocacy work for different health issues and that kind of thing. And when it comes to unusual things that I've collected, I really don't know that it's that unusual. But I have a lot of books that I have, but I've never read. So I guess you could say I collect books, but they're not rare books. You know what I'm just saying. And they're books that need to get read and get rid. Then they can move on to somebody else.
My daughter's like that. She'll buy more books, and I'm like, "Don't you have ones you've already read?" Yeah, but I got to have another stack ready to go.
And I should
Okay.
say I have a lot of books also on my Kindle. My
Yeah,
Fire tablet. So
yeah,
that's even more. But you see, at least you're not collecting them because they're only in that small tablet.
that's right. They're not collecting dust, at least.
They're out in space.
Exactly. Thank you. Thank you for being here. Crystal, would you like to go next?
Well, I sitting here trying to think. I didn't know there was going to be a test.
No pressure.
I can't think of anything I collect really.
Okay, that's all right. You're a minimalist. I like it.
Yeah.
How about Carol?
Hi, everybody. I'm Carol. I live in Beckley. I am the chair of the West Virginia chapter of Progressive Democrats of America. Plus, I'm involved in other things as well. I don't intentionally do this, but I do collect books and yarn. I just can't stop, especially can't stop with books. So I have more than I will read in the rest of my life. So
That's awesome. We all have a lot in common then.
yes,
All
I
right,
think so.
Olivia doesn't have a mic. Olivia doesn't have a mic, but we're happy you're here. So thank you. Feel free to put anything in the chat that you would like to communicate or ask. Sarah, do you have anything you'd like to share with us about your collecting or introduce yourself? Okay, well, we can come back to Sarah. How about Sally?
Yes, well, I collect everything, including people. So I am a massive collector of stuff. And of course, books, number one, and seed pods and shed deer antlers and pebbles and rocks and fossils and you name it. I love everything. So, and I was wondering if Sarah might have not been on mute or known she was on mute too.
Oh,
but
okay.
I'm also I'm Sally Roberts. Are we to introduce ourselves? I'm volunteer chair of
Absolutely.
Rise Up West Virginia and in Charleston, and a resident of Morgantown at Cheat Lake, and which I don't get to my residency enough. I'm too busy, but working hard on the issues around healthcare, and also on Juneteenth, which is a lovely, fun thing to be working on right now, and the intersection of climate and healthcare as well.
If you want to know an all-around amazing organizer, advocate of all things, and just wonderful all-around human being, it is Sally Roberts. So,
oh, thank you, Mindy. Sorry not to be on today. Lost my wisdom tooth, a little more foolish today, and I'm icing up. So,
well, I hope you're feeling better. I know the last time I talked to you, you weren't feeling well.
yeah, it'll be better now.
Good. Mary, would you like to come off mute and introduce yourself and tell us about any collections? Okay, well, we can come back. Oh, there is Sarah. Oh, you collect plants. Well, thank you for being here, Sarah. If you want to say hello to everyone.
Hello.
We're happy to have you here. Thank you. Oh, we're letting Agnes in. There we go. I think she always has trouble. Hi, Agnes. How are you? I don't know.
Agnes, you're on mute as well. Agnes is a fellow member of PNHP.
Hi.
Hi, Agnes. Do you want to tell us what you collect? Or tell us about yourself?
Oh, I'm a retired pediatrician. I live in Fairmont.
Are you safe? Is your property and everything, everybody in your home safe?
Oh, yeah,
from the
yeah,
flooding?
yeah.
Good. Good. I'm glad to hear that. I was worried about my Fairmont folks.
Oh, yeah, you mean the flooding?
Correct. Yes.
Yeah, that was down, close to downtown. It was an apartment building that collapsed.
That was frightening to see the pictures of.
Yeah, it was. No,
Well-
I'm on the top of a hill, so I.
Oh,
or not
that's good.
top, but up a hill.
That is good. Well, I just want to thank all of you for being here. There is a lot going on. The Senate released the language they want to put into HR 1, which is the One Big Beautiful Bill Act. I can assure you, everyone who has looked at it, it's not beautiful, but I'm going to try to break it down for you as best I can. There is a lot, and it's very complicated. And if you can believe it or not, it's worse than what the House version is. So we will get to that in just a moment. But I wanted to talk about some things that happened because we didn't get to meet last month because several of us went down to DC. Paul and Sally were both on that trip with me. We took 17 people from Huntington, Charleston, Morgantown, and Parkersburg. And we went down and talked to Capito's office and Riley Moore's office. It was an experience. Some folks, it had been their first time going down to DC. For those others of us, it was kind of old hat, but we tried to get a talk in with Riley Moore's office first, and we're unsuccessful, but we did talk to one of his representatives. And I mean, and Sally, correct me if I'm wrong here, but I think we were just kind of fed the same talking, just the standard boilerplate talking points.
Absolutely. Yeah.
And when you try to push back a little bit, they were they don't like it when you actually know what you're talking about. So, but I don't think we made any headway there. That afternoon, we did meet with Capito's office, and normally I meet with her healthcare advocate there, but we did get an audience with her chief of staff. So that was definitely a step up there. He was, and again, Sally and Paul, correct me if you haven't, and insert any points you would like to make from that meeting. He did seem very receptive to everything and empathetic to what people had to say. We had storytellers who have direct experience with Medicaid. We had healthcare providers. We had kind of a whole array of folks who had some pretty compelling stories to tell. And he really engaged with everyone. So Sally or Paul, do you have anything you want to add about that? If you came away feeling like we made a difference, or?
I think JT has a reputation. Apparently, I've talked to other people who've spoken with the chief of staff, JT, and have also had good interactions with him. But he certainly was very respectful. When whoever it was said that we wanted to tell have people tell their own stories, he said, well, I want to hear them. And then at the end, he was really pretty insistent that he wanted to be with us when we were taking pictures. So outside the office, I think also apparently Ace Parsi, who of Morgantown Indivisible Action Group, Citizen Action, Micah, he's had good interactions with her office as well. So anyway, I thought it went. They were much more receptive than I expected them to be. So,
Right.
He is a very pleasant person, and he is what I like to say is kind of like a very pleasant funeral home director. Going to be very nice to you as he lets you prepares you for death because they aren't going to do anything. But he does it in a very pleasant way. Yes, he does. He's a very nice person.
He was very kind. Yes.
Yes.
So whether we made an impact, but I think people felt like it was important for them to go and and at least say our piece, and make it known that we are watching, that we will absolutely come and hold them accountable, because we aren't seeing they aren't having any town halls, they aren't having any public meetings. So it really is incumbent upon us to make that effort, unfortunately. So I don't think this will be the last of our visits. The bill is supposed to be, well, the president wanted it on his desk to sign, which means it has to go through a lot to get there by July 4th, which that is more than likely not going to happen. The Senate is still marking it up. They've released their language, but they haven't voted on it yet. So that is more than likely will happen next week before they leave for the July 4th recess. So we still have some time to call, write letters to the editor, all of those things, because it is important that we still make our voices heard on this, and that we want them to vote no on this bill. And I'll try to outline all the reasons why, well, at least some of the horrible reasons why we need that to happen. We are having a town hall in Beckley on Saturday after the Juneteenth celebration there at 3 p.m. It will be at the Armory in DC, in Beckley. Sorry, ahead of myself. And we're really excited about it. We've got some great speakers. We've got Dr. Doyle from PNHP. We've got some folks, Pam Garrison, who is an amazing organizer in the Beckley area and the whole southern region there. She's going to speak. Pastor Davis is coming in and is going to speak. And we've got some others, folks who have, I'm emceeing the whole thing. So it will be live streamed from West Virginia Citizen Action's Facebook page. So if you aren't close to Beckley and would like to watch it, or in Beckley and can't make it, we'd love to have you watch it and share it out to your networks. We're kind of going to be talking about a little more in length and a little more in depth about the things we're going to be talking about today, and have some experts there to answer questions from the audience. And I'm going to be having smaller but similar talks with Crystal's group in Tucker County on, I believe it's the 28th, 29th. I've got it on my calendar, but I will be there with that group. And then 26th. Thank you. Today has been a nightmare for me. So dates, I promise you it's on my calendar. I have it correct there. So, I will be there, and then I will also be going to Preston County at the end of next month to have a talk with them. So I don't know what will have happened by then. Maybe we'll have more clarity. Maybe it will have completely, done its thing. So we'll just have to wait and see. We did have some great No King's Day events across the state. I know Morgantown had around 1,000 people between the 3 locations that we were located at. Charleston, I believe, had over 1,000 people. Did others have some in their areas they wanted to shout out?
that I didn't go to it because I went to the one in Morgantown, but I read in the online that they had a rally in Clarksburg.
Oh, that's wonderful. Oh, that's great.
Yes,
Did
there
you have
was,
something else you wanted to highlight, Agnes, or because you had your hand
No,
up? I didn't.
no.
Okay, great.
they had one in Shepherdstown that had 1,700 people.
Wow.
They had
Whoa!
one in Martinsburg. They had one in Lewisburg. I think the one in Martinsburg had 8. I think I might be wrong on that. 800. And
Wow.
the one, I'm not sure how many the one in Lewisburg had. There was one in Clarksburg. Yeah, there were so many all
Mhm.
over.
I know, it was great
There
to
was
see.
a big one in Huntington where the pediatrician that went with us to DC spoke again and did a marvelous job.
Yeah, she's great. Dr. Kate Waldeck. She's
Yeah.
she's great up in Huntington. Crystal says Elkins had one and Romney had one. I was just near Romney the other weekend. I was in a wedding. So I was in all. Okay, well, that's great. I'm glad to see that. Yeah, so many people are getting out and we're creating community, and that is exactly what we need in these times. So let's get to the main reason we are here, which and things are kind of coming in by the hour because they release, all this information and then it has to be analyzed and kind of put into layman's terms so we can kind of understand the direct impact. So things are still coming in. I'm getting my information from the Federal Center on Budget and Policy because they seem to have the most clear and direct information. So just so you know where I am getting my information from, we use the West Virginia Center for Budget and Policy for state specific information, and they're still compiling that right now, and we'll have that soon, so I can send that out for everyone as well once they get that, because they are crunching numbers to see how this is going to affect us all. But basically, what's going down is the Senate reconciliation plan is going even further than the House bill. And the House bill was pretty draconian. So if you're in one of the 41 states that adopted the Affordable Care Act's Medicaid expansion, which West Virginia did, it's going to all but almost eliminate which included millions of folks, particularly people with disabilities, veterans, and among others, who had no other pathway for healthcare coverage. It's going to impose new barriers for adults in that expansion population. And like I said, West Virginia was one of the states who adopted expansion. In fact, we were a very early adopter of that. So looks like we're getting penalized for doing that almost. It includes a provision to take away coverage for people not meeting work requirement, which would mean an eligibility check twice a year instead of annually. And I do want to talk about work requirements because of the way that they are framing the work requirements. They're talking like it is a way to make Medicaid better, make it more effective for the people who need it. I've been hearing that a lot. Make it easier for the people who need it, to eliminate some of the waste, make able-bodied people go to work, The things that they are not taking into consideration are if they have children, parents, or someone that they're helping to take care of, if they have transportation where they can get to and from work. These are all things that aren't being taken into consideration under those work requirements. And work requirements have been tried in 2 states. Arkansas was one of them, and it was a horrendous failure. It did nothing to increase their employment rate. And in fact, it cost, I had the exact number and I apologize, I don't have it in front of me at the moment, but it actually cost the state of Arkansas, I think somewhere around $45 million at the end due to administrative costs. So work requirements are simply a way for them to try to frame it like that they are, getting rid of fraud, waste, and abuse, which we know better. But what it is basically a means to kicking people off their health care. It puts up erroneous barriers for them in terms of these eligibility checks twice a year. It is a lot of paperwork. In rural West Virginia, we know we don't even have reliable broadband, so or cell service. So these people trying to meet these requirements who run into these roadblocks are going to get frustrated and just say, forget it. And they're going to lose their health care. And people are going to get sick and people are going to die. There's just no other way to phrase it. So I really, I've had some lawmakers who are on both sides of the aisle ask me, well, what's wrong with work requirements? Well, there's a lot wrong with work requirements. People should be able to access a doctor when they need one. Bottom line. Some of the other things that this will do, it's going to restrict services for those with an income above the poverty line. And those restrictions on retroactive would happen on retroactive coverage as well. It's just going to put a layer of red tape, and it's going to have an increased out-of-pocket cost, and it's going to put people at greater financial risk. So it's going to end up costing people instead of saving all this money and getting rid, or taking care of the fraud, waste, and abuse that they think is there. That it's going to end up putting people who are already struggling in poverty further into poverty. It also plans to impose financial penalties on the expansion states that would not apply to the non-expansion states. So West Virginia would be charged a penalty because we offered healthcare to folks. Someone explain that to me like I'm 5, how that's okay, but anyway. I'm sorry, some of this stuff just came in this evening, so I'm still trying to process it as well. It plans to cut federal funding to expansion states, so West Virginia, for emergency services for people who would qualify for Medicaid expansion, if not for their immigration status. So we are going to hurt, people who are here.
I think it will also, if I'm not mistaken, take away the ability of states to do the workaround with the funding from physicians and hospitals that they get reimbursed for through Medicaid. So that will be taken away, which will devastate West Virginia too, because that's a big part of our Medicaid program.
Well, and another thing that they want to do is, and I again don't understand it. They want to lower the age of dependency to 14. So if you have children who are over the age of 14, they would not qualify as dependents when considering your income. So, and I can promise you, I have a 15-year-old, and he is extremely dependent on me. Definitely utilizes our refrigerator quite a bit. So, um, yeah, I don't understand this. So again, if somebody has more information as to why that could be considered a good thing and can explain it to me, I'd be happy to hear it. This is, and it wants to it's just talking about all of the, it's just, all it's going to do is cause people to lose their coverage, bottom line. And I want to make one thing extremely clear is that this is the first step to dismantling the Affordable Care Act. And people, particularly in rural West Virginia, really like the Affordable Care Act. They don't like Obamacare, even though it's the same thing. So, but they've really benefited from that. And to see everything, kind of coming crumbling down is horrific. It's horrific. And I think the Doctors Hill's boss might be able to even kind of elaborate on this. This is going to decimate rural hospitals because of the amount of reimbursement that they get due to, for Medicaid patients. And if these are taken away, if Medicaid is cut for these people, they're going to be providing uncompensated care. If they're willing to do that, these people are going to be going to the emergency room, and emergency rooms are going to take uncompensated care. Rural hospitals will have to close. Nursing homes will have to close because they get a significant amount from Medicaid. We're looking at an employment crisis because healthcare is the largest employer in West Virginia. And if our rural hospitals close, that means that we lose those jobs as well. So it's a ripple effect. What are we going to do with our family members that require nursing homes that can no longer go to a nursing home because it's been forced to close because it can't sustain itself? How are we going to take care of those family members? And it's also going to increase costs for Medicare patients. And that's still being reviewed. Yeah, and as Carol is pointing out, that those who are dual eligible for Medicaid and Medicare are facing cuts. And it's going to affect Medicare overall in terms of higher out-of-pocket costs. Oh, the age of dependency in the House version was 8 years old and below? Ah, I didn't catch that. Thank you, Richard. I hadn't caught that in the House version. Goodness gracious, these people. So, yeah, does anybody else have any other information that I might be missing? I do have, it's kind of like a constantly updated page that has the up coming in and people are analyzing this. I will share it here. Like I said, it's from the National Center for Budget and Policy, but I'll share it here. Dr. Hillsbaugh, is there anything that you can think of that maybe I've missed or should that you know of? I know
Well,
that you've got your
Mindy?
finger on the pulse of what's happening.
If I may say something,
Oh,
this is
yes,
Rob.
let me just tell Dr. Hillsboss he's on mute, but
Mhm.
yes, Mr. Freelander.
So I'm a little new to this or the organization, but I think the facts and things you're sharing are not too new or questionable by any of us. My question is, what can we do in these times to help our representatives represent us instead of party politics and holding their jobs?
Right now, it's calling. The calls do make a difference, especially when we do them in mass. So I need you and to tell 5 of your friends to call daily and get and have them get 5 friends to call, because they can't ignore it, and they do have to keep a record and a tally of who's calling, why they're calling, and what they want, so that it is tabulated. And in fact, before the Senate had released their language, both Justice and Capito had said that they had heard from their constituents. They were concerned about the rural hospital aspect, and that they had concerns about the House bill. So if they had concerns about the House bill, they've definitely got to have concerns about this Senate language.
So do we believe in any sense they are actually willing to say that in front of other Republicans or to the president?
I mean, to be honest, if you had even told me that Justice would say that to somebody in the press, I would have told you you were nuts. But he proved me wrong and came out and said it. So I think he is movable on this.
So Justice was on the news. I think it was last night on PBS NewsHour. He was listed among several senators who opposed, and his recent opposed the Senate increasing the cuts in Medicaid.
But he just wants them more at the House level, which are still too much. It's what I heard, but I don't know if that's true.
So the question is, will they actually vote what they're saying?
I mean, that's unfortunately that's anybody's guess.
I have these questions about, in my mind, what's going to happen to rural hospitals. If I may, Mindy, I mentioned in an email that I had said in a meeting that hospitals would close, and as I was preparing for this empty chair town hall that we had in Morgantown, I found out that I did not want to go into the amount of detail that would be required to back up the statement that hospitals will close. A lot of it comes down to the fact that a large number of hospitals in West Virginia, something like maybe 60% of them, there are 20 some hospitals that are critical access hospitals, and they never mention on the news whether that funding is in jeopardy. Does anyone know? And I can explain what it means to be a critical access hospital if the group is interested. It may be that everybody knows that already. But is that funding in jeopardy? Do you know anything about that, Mindy?
I do. If you can bear with me here just a second. Senator Markey, his office did a study, and they listed the hospitals in each state that were at risk of closing. So if you can bear with me here for a second, I can pull that up. I
did hear the study. And to me, it appeared that the train had already left the station in West Virginia because the critical access hospitals had downgraded from a full service hospital. And so many hospitals, the large majority of really rural hospitals, way out in the country type hospitals, have already crossed over to that critical access status.
The ones they have listed here are Logan Regional Medical Center, Welsh Community Hospital, Broadus Hospital, Mini Hamilton Healthcare Center, Grafton City Hospital, Montgomery General, and Jackson General. And I can include this letter with the lists.
I wonder, is that something you could send out or put in the chat or something?
I can email it to everyone after this meeting. I've got to transfer it. They texted it to me for some reason, and so I've got to move it from text to my email. But yes, I will absolutely do that.
So I'm describing it simplistically as cost plus financing, and if that were to hold, then it should make up the loss that they would suffer from loss of Medicaid. Hopefully everybody's clear that if somebody loses their Medicaid, they will still get care up to a point, but the hospital will be left holding the bag because they'll go to the ER, and in general, the ER is not allowed to turn anybody away, so they have to provide the care, and that's going to represent uncompensated care, which adds up to lost money for the hospital. So a hospital could end up closing, but on the other hand, most hospitals in West Virginia would tend to go over to critical access status so that they could get that extra funding, but they would also be operating under some strict limitations.
I
And
have
would
heard.
it not?
Oh.
I'm sorry. Go ahead,
Go ahead.
Sally.
I was just going to say, I have heard that they are talking about removing the requirement that people are treated at emergency rooms too, which is really concerning.
Well, they have removed it in relation to reproductive care, sort of. It may
Yes.
be a little too complicated to get too complex to get
Yes.
into it in this call, but
Yes.
that would be EMTALA,
Right.
emergency medical treatment and labor, an active labor act.
Right. But
And
this
that
is more broadly, right?
that law is certainly under assault, at least in the reproductive health care arena, and suffering damages.
Would it
It's not just under assault.
Dr. Hillsboss, if right, if a rural hospital is suffering financial loss, but isn't at the point where they would close, they would have to shut down certain departments or practice areas. Is that not the case?
I think the simple answer, the short answer is yes. I think you're right. And
Okay.
my hospital closed. My hospital was not eligible to become a critical access hospital, for reasons we can go into if you like. The hospital closed, and long before it closed, they closed departments like pediatrics.
Mhm. Right. So I think a lot of what we're seeing is that people, children, people with disabilities, and the elderly are really going to suffer. I mean, well, everybody's going to have a cost with this. There's going to be a lot of cost, and West Virginia is probably going to be at the top of the list of folks or states that will have the most to lose, because we have such a high population of folks who qualify for Medicaid, and because we were an expansion state, now they're putting in penalties. They're saying they want to shift a lot of the cost over to the states. However, West Virginia doesn't have the budget to take on any of it. We first thought we were in a surplus, and now we're in a deep deficit. So we have no way of making up those funds in order to provide care for folks. So
Well,
basically,
there was a law passed that if we lose a penny of the expansion money, then the whole expansion goes away. Does anyone want to comment on that? Is that going to be a reality? Sally probably knows a lot more about this than I do.
Actually, that was a bill introduced this legislative session. They pulled the bill at the last second
I didn't know
because,
that.
yes, it did
Go ahead,
not
sorry.
get passed because they got reassurance from the feds that, or the federal delegation, that the FMAP wouldn't change. So the percentage that we would get from the federal government, which we get 90% funding from the federal government, and the state provides 10% for Medicaid. So, so that is, they were assured that that match would not be affected.
I thought it was just not, it was 90% from the feds for the expansion, and for non-expansion, it was in the upper 70% of some sort. But anyway, which is one of the highest in the country. The 70 something percent is like 76, 77%. But
Correct. Yes.
that's
I apologize.
that's okay. I mean, that was, but you're right. Somehow they got that assurances because they're going to try to wipe out whole parts of it anyway. So anyway.
Mary, you've been trying to raise your hand. What would you like to bring to us? Mary, okay. She says she keeps getting disconnected. So, and we had a suggestion about you. Gives you, it connects you directly with your legislative folks, and my connection is unstable, and it will give you a sample script to follow. So that is very helpful. And Sally tells us all to call, and I'm trying to read the rest of it. Participating. And she has, there is a potential nonviolent arrestable direct action that's being planned, and to contact her. She has her number there if you are interested. Mary got disconnected again.
I have another question, if it's possible.
Absolutely.
In terms of action, I heard what you said, call. Nationally, I'm seeing some things like people seeking donations or actions. I'm wondering what you all think of the worthwhileness of. One is a group that's trying to raise money to put up billboards in state where their representatives are voting other than we would want them to. And the other is a postcard movement where somebody's talking about they will send you a bunch of postcards that you can then distribute to people so they can write their Congress people.
We have postcards. Mindy knows about that. We have postcards.
Yes, we have. I'm sorry, I'm responding to somebody in it's the fire calls.
Anyway, CAG has postcards along with the Center on Budget and Policy, and the just a collection of different organizations have put together a postcard on this event. So if you want some, let us know and we can get them to you, definitely.
I will happily bring them to you or send them to you, whichever is easiest. And then also, they are specifically going to Capito. I am doing something here where you can record a video, and we're going to string them together and send them to his office, to Justice, or you can do a virtual postcard. And again, we'll string those together and forward those to his office. And so I'm putting those links in the chat right now. Indivisible has actually, I saw today, has some digital billboards in Morgantown targeting Capito.
And
so
if you're in the Eastern Panhandle, every Monday, there is a Moral Monday March with the Reverend Barber, Bishop Barber, and they are meeting with various members of Congress. So that is another way to get involved. There's so many ways. And telling your story, even calling and telling your story, putting it on social media and sharing it, especially if you happen to be on X or something like that, which I know not a lot of people want to be on anymore. But if you happen to be on TikTok or any of those kinds of social medias, telling your Medicaid or Medicare or healthcare story, and or the story of someone you love or know, really matters. It mattered when we were dealing with the vaccine issue, and it still matters, and it's still working when people hear these stories and see the damage that people underwent because they didn't have vaccines, for instance. It makes a difference. It really makes a difference.
It does. And I posted a link where you can record your story if you want to, and we can share it on social media on all of the channels and send it to our representatives. And so that you can share that out, because what the power of that is also that it encourages other people to do that as well. It takes away that stigma of, you know, I'm the only one going through this. It helps empower other people. For those of you that don't know me, I had to ration insulin for a year due to the cost. I had insurance, and still, because of the copay, I had to ration. And when I told my story and went public, it was amazing how many people decided to follow me and come out and speak out, and how much attention we were able to get to that issue. And so that's how I got into this work. Yes, Mr. Williams.
Yeah, I would just like to say, we're talking about taking some actions and things like that. There are a number of groups around West Virginia, and you already spoke about some of those, but a number of indivisible groups are in cities like Shepherdstown, Lewisburg, Romney. They're all over the place. And actually, I run an indivisible group as a Zoom meeting every Thursday evening, that the intention is to get somebody from each county to come to the meeting so that we can, spread the word and talk about things and that sort of thing. And if anybody would be interested in something like that, I can put that information out here in the chat. And, maybe we have 150 members right now from, pretty much every place except right along the Ohio River, from between Parkersburg and Huntington. We don't have too many members over that way, but we do have people in Parkersburg and people in Huntington, Charleston, Mercer County, all over around the area edges of the state anyway. But what I was saying was we have about 150 members right now, but not everybody comes to the meetings. A lot of people have joined because when we do the meetings the next day, I send out pretty much the transcript of the Zoom meeting. And, a lot of them just get that and they're satisfied. So if that's something, somebody would want to do, we could put you on the mailing list and send you out at least that. You don't have to participate. I never ask for money. All we do is talk. So anyway, that's out there. If anybody is interested, you can find us.
That's great.
Yeah,
Thank
the name of the
you.
group is West Virginia Indivisible Team 55. And if you want to send us an email, it's just at gmail.com. West Virginia Indivisible Team 55 at gmail.com. And we'll get in touch with you and maybe get you in touch with other parts of the state a little bit and try to make a little bigger push.
got a large group here, part of Citizen Action. We're also willing to help
Mhm.
Mr. Williams with other areas that want to organize their people
Right.
and get larger groups together. We're more than happy to help make
yeah.
that happen, and give some trainings on how to organize, and how to make this a bigger movement,
Right.
because we all need to work together.
I know you're associated with the Morgantown group, and they're just right down the street from me pretty much. So I'm between Fairmont and Morgantown. So
Oh, okay.
I'm a member of that group, and they're a member of this group. So, we're all together kind of, but hopefully this gets out around the state a little bit more, and at least it's an informational kind of thing, I hope. So
Yeah, that's kind of why I'm going on tour this month.
yeah. Well, that's my 2 cents for the meeting. And
No, please put your contact information in the chat. Folks are asking for it. And
yes.
and yes, I think Sally's also put in here, if you're a physician or other healthcare worker, and can, share your experience or stories with your patients legally, that's something that's extremely powerful. Or if you know someone who can, it's also very powerful. We have about 2 minutes left. So again, I'm always a stickler for starting and ending on time because I respect all of you. I'm going to put my email in the chat. As always, please reach out and message me. I will send out information of the things, the links that we talked about, the contact information that's been listed in the chat. And some other information for you to share out, how to get, you can get in touch with me there if you want postcards. I'll also be sending those links so that you can record videos that are in the chat if you'd like. And I'll send out Richard's information on his Team 55. We have to stick together, and and like I was telling Mr. Freelander, we have to invite people in with us. So for next month's meeting, if all of you can invite 5 of your friends, I'd love it. If you can take 5 of your friends with you to, have them write postcards. Anything that you're doing, invite others to do it with you. And I think that is how we're going to combat a lot of things that are happening right now, is just inviting people to join us, because a lot of people don't know what to do. They don't know what's next. They don't know what the next step is. So we need to invite them along with us. So please reach out to me if there's anything that I can do. How's everybody feeling? Are we okay? Was this informational for you? Was it helpful? Was it need me to go back to the drawing board? Yes, Agnes.
Just a question. Can you go through what the timeline is for the Senate bill? You said they're going to recession next week.
They are supposed to, there's talks that they could vote by Wednesday. Whether they will or not is a good question. They have already recessed for the long weekend because of Juneteenth. They recessed today and will be back on Monday. And I've heard they could vote as early as Monday. I mean, vote as early as Wednesday on it. But we just need to keep the pressure on. So please use the 5 Calls app. It's great. It has sample scripts. It's available on Apple and Android. So you can download that. It's a great resource. And if anybody else has anything else you want me to pass along to the group, just email me. I'm happy to do so. But I'll keep in touch with everybody and keep you updated as I hear things as they come in. So thank you all. I appreciate you being here. Go talk to your friends and let's make a difference. And go do something that brings you joy. Go take 10 minutes and do something that brings you joy. We need that right now to rejuvenate our spirits. So please go do that. Have a good evening,
Great.
everyone. Thank you.
Thank you.
Thanks,
Thank you,
Mindy.
Dr. Hillsboss. I appreciate you and your information. You're always a great resource.
Thank you.
Yes, he is.